In this video, we will continue our discussion about the therapies that can be used, or therapies ideas that can be used to treat the disease or this congenital disease for glycosylation. So in this video, we will cover mainly on galactosylation, the problem with the galactosylation. In the previous video, we have covered, or we have just touched upon this topic, that the deficiency or improper galactosyl transferation will cause problems in the post translation modification or glycosylation, and this can be dealt with addition of manganese to sulfate. So in this video we will cover somewhat in detail about those galactosyl transferase or those problems related to manganese deficiency. So let us start with the first one. First disease, that is called as SLC39A8. Its full form is solute carrier family 39 member 8 CDG. So this problem is mainly occurs when the cells has impaired transporter for this manganese to sulfate manganese. So because of this, what happens is that there is deficiency of manganese within the cells, and the manganese interact with this galactosyl transferase to manganese interact with galactosyl transferase uh, for this galactosylation process, and this galactosyl transferase is mainly found in the Golgi apparatus. So there is weak galactosylation occurs in the Golgi apparatus, and because of this the final proteins will not have the native post translation modification. So in order to counter this weak manganese reporter on the cell surface, uh, one of the therapies that is suggested is to uh, increase or is the oral supplementation of this manganese to sulfate. So when the more amount of this manganese are available to this impaired manganese reporter, there is more possibility that, or there is a great possibility that high manganese transfer will occur compared to the previous case, or compared to the defective case. So by this or through this approach, they can compensate the low manganese to sulfate within the cells, and this manganese can interact with this galactosyl transferase and perform this normal galactosylation. The other CDG related to this galactosylation is this TMEM, the 165 CDG. So what happens in this case? The Golgi ion transporter is defective. So because of that, what happens is this: it disrupts the manganese homeostasis within the Golgi apparatus. So in order to counter this, what it requires is, in order to counter this defective ion transporter, it requires the increase in the amount of this galactose. So increased amount of galactose will help in this, or will help to counter this defective ion transporter. Then it can, this galactose, uh, the increased amount of galactose will also compensate the galactose that are present within the Golgi apparatus, as if more amount of galactose are present, there is more possibility that these galactose will be transferred to the Golgi compared to the defective case. This is how this TMEM 165 CDG uh, can be treated, or therapy can be provided for the patients that are affected with TMEM 165 CDG. The last one is the SLC35A2 CDG. So in this case, what happens is that there is a defective UDP galactose transporter in the Golgi. So this UDP galactose transporter this is defective. So in this case also what can be done is that this we can inject this galactose directly into the cells. So instead of this normal process that goes from uh, fructose 6 phosphate to this UDP formation, we can directly inject this UDP, or we can directly inject this D-galactose to the cells so that they can go to the Golgi and perform its normal galactosylation process. So these are the three therapy ideas that can be used to treat these three galactosylations kind of diseases. Galactosylations, CDG, congenital disorder of glycosylation. So if you need to understand about these therapies in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.